Hello everyone. In this video, I'm going to talk about personality disorders. And personality disorders are really interesting, really complicated, and really difficult to diagnose. Not necessarily commonly diagnosed, but you're going to recognize some of the different personality disorders and um, I think many people are really fascinated with this idea of personality disorders. And we're going to talk about how are personality disorders different from mental illness and the psychological disorders. So personality disorders are a pervasive pattern of behavior, so that it pervades the whole person's life. And they have difficulties with relationships and overall functioning, just an unusual way of dealing with the world. Approximately 1 in 10 adults in the US have a personality disorder, which is 10% of us. That's a lot. And usually the onset is in early adolescence or adulthood. We'll see different behaviors in adolescence and early adulthood. A person's often unaware that they even have a personality disorder, and often they don't really seek treatment because they don't think there's anything wrong with them. So they're not mentally ill or out of touch with reality. So this is the BTK killer, Dennis Rader. I don't remember how long ago this was, but what BTK stands for bind, torture, and kill. And he was a serial killer and would be diagnosed and was diagnosed with antisocial personality disorder, which we're going to talk about first. But I want to talk a little bit about the difference between personality disorders and mental illness. There's no loss of contact with reality. There's no hallucinations, no delusions. There's no known chemical imbalance. There's no medication to treat different personality disorders. Oftentimes, personality disorders don't present for treatment. Usually, antisocial personality, especially, is identified in the criminal justice system. We do know that there is a lot of environmental factors that may lead to different personality disorders, abusive parenting, difficult childhoods, traumatic childhoods. So we're not 100% sure about all of the causes of personality disorders. We'll talk a little bit. There are genetic components as well. So there needs to be a lot more research in the area of personality disorders, but oftentimes it's difficult because they're not the primary disorders that show up for treatment. So these are three different groups of personalities. We're only going to talk about some of the cluster B personality disorders. Cluster A and cluster C are kind of less common, and it's a lot to learn. It's pretty complex to really understand all these different personality disorders. So we're going to talk about antisocial personality disorder, and this is it's not. I don't know if I like the way this is worded, but it's what you guys would know as a psychopath or a sociopath. These are people that don't care about other people, don't have feelings towards other people, just want to use other people. So we'll talk about that. We'll talk about borderline personality disorder and narcissistic personality disorder. So antisocial personality disorder is not somebody that's antisocial. They tend to use people and they tend to have people around them, and oftentimes they seem to be very charming, likable people. But they have no conscience. They don't care about other people. They don't worry about harming other people. They don't worry about getting caught. They really they don't really have the emotional responsiveness that that normal people do. Often people with antisocial personality disorder can pass a polygraph test because they don't get worried. They don't get scared they're going to get caught. They just, they have a very even emotional or lack of emotion. They're emotionally shallow, they're impulsive, they're very selfish and manipulative towards other people. The terms psychopath and sociopath are older terms and they're still used in legal proceedings. I've heard psychopath meaning somebody that has antisocial personality that has committed a heinous crime, so that might be a good definition of it. But we use the term antisocial personality disorder in psychology, and it's considered a psychological disorder. But everybody with antisocial personality is not necessarily a serial killer. Many are delinquents and criminals, but many of them are not crazed murderers. They might be an unethical CEO or an evil boss that you've had. They can be con men. I don't know if you guys remember Lou Pearlman, but he was a record producer, and he recruited the Backstreet Boys and NSYNC and made them into a big hit, but he took all of their money. He basically stole from them, and I don't know that any of them ever got their money back from him. Also, people that molest children are antisocial personality. They don't worry about harming that child. They don't care about whether they harm that child. They're only looking for their own satisfaction. Sexual sadists are people that get sexual pleasure from harming another person, which is pretty awful. They have a long history of conflict with society, often in childhood, lots of behavioral issues, poor relationship. But oftentimes they can make a really good impression. They know the right things to say. They can be very charming. But they're really incapable of love. They don't have any empathy. They don't understand that other people even have feelings. And they don't feel guilty about things. This is the DSM criteria for antisocial personality disorder. I have posted all the PowerPoints right above the videos here, so if you ever want to look at any of these slides in any more depth, feel free to do that. This is a book that I would highly recommend if you're interested in this. Robert Hare is one of the premier psychologists in studying antisocial personality disorder, and he came up with this psychopathology checklist. And these are all the different factors that he looks at. They're prone to boredom. They need a high level of stimulation. They're impulsive, irresponsible. They don't have any long-term goals. So really detailed information about how we might diagnose antisocial personality disorder. So we know that there's often a childhood history of emotional deprivation and abuse with people who suffer from antisocial personality disorder. There's also appears to be an under-arousal of the brain. They have a high need for stimulation. They're sensation seeking, and they often don't respond to high levels of sensation. Most of us would be panicked that we might get caught. If we had a polygraph test, our anxiety level would be really up, but they doesn't even faze them. There is some evidence that they may have a smaller amygdala, or there may be some amygdala abnormalities. And as you remember, the amygdala is the emotional center of the brain, so it's possible that there are some abnormalities there. There's definitely evidence of heredity. Children of parents who are antisocial may also follow the similar path. So Charlie Manson here, if you guys remember him, his mother was definitely antisocial personality disorder. She was in and out of prison, and she didn't know who his father was, but she definitely was antisocial, and he definitely was antisocial as well. So it's really difficult to effectively treat because they usually lie and charm and manipulate their way through therapy. They don't see a need to change. They think they're perfect. It's not a diagnosis that's given lightly. Usually a person is in the criminal justice system and they get a really thorough psychological evaluation with an MMPI and IQ testing and lots of other tests that are really important. So here's some famous antisocial personality disorders that are serial killers. I'm going to post a video of Dennis Rader, and it's a short video. He killed 10 women over, 10 years or so, and I think he was like a DPS officer. He was married, he had 2 kids, so he had this kind of normal life, and then on the side he was going and murdering these women. And BTK stands for bind, torture, and kill, so he had all these fancy knots and things that he would use to bind these women, and he would leave their bodies in different places. But he killed over a 10-year time frame, I believe. You guys might know Ted Bundy. There's been some specials recently about him. I'll post a video about him. But he was a very charming, intelligent, nice-looking guy who killed 30 women at least. If he confessed to 30 homicide, but he suspected of many others. And he would lure these women and bludgeon them to death, beat them to death. And there's some information that he had a girlfriend that rejected him and that he was angry about that. But he had a regular girlfriend. He worked on a suicide hotline at some time. So some crazy stuff. And this Tommy Lascelles guy was convicted of 22 murders, and it's just chilling how he talks about things. You guys probably know Jeffrey Dahmer. He was a bit twisted. I, I don't know if he was purely antisocial, but all of these people have been diagnosed as antisocial personality disorder, except for Ariel Castro, because he killed himself, and John Wayne Gacy, I think, that's kind of an older case. And I don't know, this Brian Miller, I don't know if any of you remember this case, but this is a case that's happening in Phoenix right now. He was supposed to go to trial in June of 2020, but since COVID hit, the trial's been postponed. But his DNA matched two murders that happened back in the 1980s. He killed decapitated one of the young women. It was like at I-17 in Cactus, and they found her body and her head separate in the canal, and these women were just riding their bike along the canal there. And then there was another young woman that was killed along that canal as well. And you guys may remember Adrienne Salinas that was murdered not too long ago. I should have looked up. It was 4 or 5 years ago. She was going to a community college in Mesa, I believe, Mesa Community probably, and her car broke down. She got two flat tires. She was walking to her boyfriend's house, and she was going to get a cab at a gas station and never showed up for that cab. And they found her body like months later. But Brian Miller was in the area at the time at a party, and so there's speculation that he might have been involved in her murder too, because her murder was just a really random murder. She was, complete innocent victim. So something to think about. But one of the things I was going to cut that out. What did I do? Oh, okay. So I was going to say that serial killing has actually declined. It was in its height in the 1980s, and it's declined now because we have DNA evidence to convict criminals much, much more quickly, serial killers much more quickly. In the 1980s, we did not have any DNA evidence to convict them with. In the 1970s, we didn't have that. And in the early 1990s, we didn't even have that. But today, I think these serial killers are getting caught much, much more quickly before they can kill 30 people, 90 people. And I wanted to talk a little bit about, typically, serial killers have commonly been considered to be white middle class men. And if you look at the pictures here, these are pretty much white men, although there is one woman, although she has a different motivation. She killed 7 men, but she had been abused by men, hated men, and just wanted to kill them. It wasn't for sexual pleasure or anything like that, which many of the other serial killers are. So commonly white middle-class men, but there have been men from different cultures that have committed serial murders. The Samuel Little guy, I don't know if he looks familiar to anybody, but this is really recent. He was arrested, I believe, in Florida, but he murdered women all over the United States, and he confessed to over 90 murders, and he's actually a pretty decent artist, and he's drawn pictures of the women that he murdered and given police different locations of where they might find the remains, and his information has been shown so far to be accurate. So he's in prison right now and awaiting trial. But it's amazing that he could have killed this many people over this long period of time since the 1970s. And I don't know if he was caught and that's where he decided to confess or how that happened. I think that was the case. This Englishman, Harold Shipman, is suspected of 250 murders. That's amazing. And he looks like just a normal guy, right? And then, of course, the Night Stalker, Richard Ramirez, in the 1970s was Hispanic. So it certainly occurs across other cultures, and especially here in the United States, but it occurs in other countries as well. So interesting thought. But serial killers we don't see as much today. We do see mass shooters, unfortunately. And many of these mass shooters, like I talked about James Holm and Jared Loughner, do have mental illness, primarily schizophrenia, but often other things as well. Adam Lanza was the Sandy Hook shooter who killed all those little elementary school children and some of their teachers. But he was a very disturbed guy. He killed his mother first, and then he went and killed all these children. But he had been diagnosed with Asperger's as a kid, and Asperger's is not necessarily a violent disorder or any reason for anybody to think that there could be violence. Um, but he was also anorexic. He was 6 feet tall and he weighed 112 pounds. And he was living in his mother's basement, and his mother was afraid of him, and yet didn't get treatment for him. I don't remember. He was probably in his early 20s, maybe, and he may have been schizophrenic, but he was totally untreated. So really terrible situation. So some mass shooters do have a mental illness, but many of them have personality disorders. This Las Vegas shooter, Dylan Roof, hated black people. I think it was the North Carolina church. He went and just shot up a small group of people doing a Bible study. Really sad, and was proud of it when he did it. Timothy McVeigh was the Oklahoma City bomber, and he was very anti-government, very angry with the government. He had been in the military, and I don't know if he felt wronged, but he just wanted to hurt as many people as he could. And so many of these mass shooters they're looking for their 1 minute of fame. They may be disconnected from society, isolated. They may be powerless, angry, unsuccessful in life. And they may connect with each other on the internet or get guns and other things. So many of these mass shooters are angry people that may suffer from a personality disorder. So Elliot Rogers, I don't know if you all remember him. This happened in 2014, so not too long ago. Would probably be a very good example of narcissistic personality disorder. He shot himself right after the murder, so we don't really know. But we do have a lot of information in his writings, which I'll show you, that indicate possible narcissistic personality disorder. So he went on a shooting spree and he killed 6 students. He was at UC Santa Barbara, beautiful place. His dad was a Hollywood producer. His parents had money. His mom was a nurse. His parents were divorced, but he had parents that loved him, cared about him, supported him, gave him a BMW, so he had a black BMW. And what he did, he was very angry at women. He was really mad that women didn't like him and rejected him, and he wanted to punish women for rejecting him. So on this particular day, he posted a video, which I'll post for you guys if you want to listen to it. It's hard to listen to it because he's just so self-involved and so sorry for himself when he's got everything in the world that he should ever want, but he is missing some social pieces. So what he did is he posted this video, and then he went on this shooting rampage, and he started off at one of the sorority houses on campus, and that's what he wanted to do, was harm the sorority girls because they rejected him, and they wouldn't answer the door. And so he just started randomly shooting people that were walking around the area, and then he drove to downtown Santa Barbara and started shooting people there. And then he crashed his car and killed himself eventually. But his parents had seen his post and were rushing down there to try to stop him. I don't know that he said in his post what he was going to do, but they were really concerned about whatever he posted. And so they rushed down there to meet him, but it was too late by the time they got there. And they said that he had been diagnosed with autism spectrum disorder and pervasive developmental disorder as a child. So he had some deficits or some difficulties as a kid, and he had been in treatment. He was currently, I think, seeing a counselor. I don't know if he was on medication or not, but he just couldn't connect with other people, and he felt very lonely, very angry, and he got so angry that he decided that this was the thing to do, was to take out other people, because it wasn't fair that other people had a happy life and he didn't. So, but he also felt like he was special, like he was godlike, like, why don't these women like me? I'm perfect, you know. He sort of had a lot of delusions. He felt entitled to love, and why didn't these women like him? So this is a 141-page manifesto, basically, that he wrote all about his experiences. And he started like at age 0 and wrote every experience of his life that he could remember and how he was wronged in that life. And this is a really good example of narcissistic personality disorder, in that he's so focused on himself and he thinks he's the only person who's ever experienced rejection of a girl. And what happened, he was at a summer camp and some of the kids were tickling him, and he bumped into this really pretty girl who said, get off me or whatever. And he was totally traumatized by that for life. It was his first experience of female cruelty, and it traumatized him to no end. And so he wrote this whole 141 pages and posted it on the internet. This link is still good if you want to go read any more of this stuff. Um, but it's just amazing that he had no insight into himself or other people at all. This is the diagnosis for narcissistic personality disorder: an exaggerated sense of self importance, expecting to be recognized as superior, exaggerating achievements and talents. So interesting. So the very last disorder I want to talk about is borderline personality disorder. So this is a difficult disorder to understand, and it's often a really negative diagnosis, although I don't think it should have to be. Often people diagnosed with borderline personality disorder have just a really unstable sense of themselves, an unstable sense of their emotions, difficulty controlling those emotions, and often just feel empty and like they're so different from other people. And that's something that we can actually really help with counseling. And one of the things about personality disorder, especially borderline personality disorder, is oftentimes people not only have the personality disorder, but they may also have a mood disorder. They may also be depressed. They may also be bipolar. Um, so they can have multiple disorders, not just the personality disorder, and that can complicate things as well. So people with borderline, they have a fragile sense of themselves. They're impulsive. They may do stuff that's pretty damaging. Substance abuse. They may have unprotected sex, promiscuous sex, spend money. Can look a little like bipolar, but it's different than bipolar, and sometimes they can co-occur, but it's not that common, but it sometimes can be misdiagnosed because they look very similar. They quickly attach to people. They have this fear of abandonment, and they can be really suffocating, and oftentimes they attach so much that people just feel like you have to back off from them, and then they get even more and more desperate to connect with that person. So they have a really intense fear of real or imagined abandonment. They're emotionally unstable. Their emotions are really intense, and they kind of come across as really extremely needy, because they want constant reassurance of their relationships. And so they often live in real extremes, and that's one reason why I can get confused with bipolar. They either love you or hate you, and they seem to have really extreme highs and extreme lows and nothing in between. Jodi Arias was the woman that killed Travis Alexander, and she was in love with him, wanted him to marry her, and he rejected her, and she became so angry that she killed him. Pretty good example of borderline personality disorder. She was diagnosed by several psychologists that evaluated her as borderline personality disorder. And I don't know if any of you saw this movie from the 80s called Fatal Attraction, but it's a really good example of what borderline personality disorder is like. So I can't see this very well. Commonly female, childhood trauma is often a big part of people that have borderline personality disorder, have suffered childhood trauma. Often mothers that are borderline often have daughters that are borderline. Mostly females, more women have borderline personality disorder than men, but men do also have borderline personality disorder as well. But often these women and men suffer from childhood trauma. Often they may be abused and may be idolized in one situation by their abusers, and then physically or emotionally abused by their real parents, and so can have a really difficult time in life. So sometimes they call borderline emotional dysregulation disorder, just because of the intensity and instability of the emotions that the person feels like they can't control. Often people with borderline will have recurrent suicidal attempts, self-harm kind of behaviors. because they just feel so desperate about whatever the situation is. I saw many, mostly women, that had attempted suicide because a relationship broke up and they're trying to get that person to come back to them, and they may use suicide to try to cope with the situation because they don't have really good skills to cope with that situation, but also in a desperate attempt to get that person back. And sometimes it works, and so it kind of reinforces that behavior as well. But definitely, borderline is often comorbid with different mood disorders and often substance abuse too, and so that really complicates diagnosis as well. So borderline thinking is very black and white. It's either good or bad, and there's nothing in between, whereas the rest of us recognize that there's a lot in between. So there are some good treatments for borderline personality disorder. The best treatment is called dialectical behavioral therapy, and this is an example of some of the skills that the person would need or would learn from that. Distress tolerance, learning to deal with those emotions and diffusing the situation rather than making that situation worse, and understanding that stress is part of life and you have to live with it and deal with it. So definitely, this has been a really effective treatment for helping people understand borderline personality disorder, understand themselves, and be able to learn to understand some of these things as well. And also, we would want to treat the comorbid disorders. So, if there is a depression or a bipolar or anxiety symptoms, we want to be able to treat those as well. This is 10 different signs of borderline personality disorder that I thought was interesting. Is something you could look at later if you want, and that's the DSM criteria as well. So that is it on personality disorders. So there's a lot of research that really still needs to be done on personality disorders, but they're a really fascinating part of psychological disorders, and they're very different from some of the mental illnesses and some of the other psychological disorders. So I hope you found this interesting. I definitely will put some interesting videos up about some of the serial killers here. Thank you for listening.